Hello again, this is Dr. Drew Hall with Upper Cervical Healthcare of Los Angeles and Carson. Today what I want to talk about is spinal arthritis. Now, arthritis is kind of thrown around out there really loosely. In fact, probably 50% of the new patients that we have come in our office, they have arthritis on their intake form. So what is arthritis? We'll break this down into Latin. Arth means joint. Itis is inflammation. So basically what it means is you have inflammation in the joint. What causes arthritis? There can be a host of things that can cause arthritis, but the most common one is injury. So you get in a whiplash car accident, you take a soccer ball to the head, you dive off your diving board, hit your head on the bottom of the pool. You're 2 years old and you fall down 2,000 times learning to walk. So as we traverse through this thing called life is inherently full of trauma, and it's usually not just one trauma, but what happens is a number of things. When you have a whiplash injury or trauma to the spine, every joint in your spine has a very fibrous ligament that wraps around it. It's called a joint capsule, and it gives the joint integrity, keeps the joint stable. When you have injury to the spine and it's a blunt type trauma and you get misalignment in the spine, it tears the joint capsule, the soft tissue, and then what does the body do? It does the best that it can in dealing with it. So there's a cascade of things that go on. When you have a whiplash injury or whiplash type injury and you have the upper neck vertebra and joint injured and it becomes locked, the first thing that happens is the muscles through the spine become imbalanced. One shoulder typically gets higher than the other and you can't see, but this pelvis also becomes unleveled. So upper spine injury causes imbalances through the whole spine. You get tighter muscles in certain areas versus the other of the spine, and what does this do? Now all of a sudden you have asymmetry in muscle tone through the spine. You get abnormal movement. When the spine's healthy, both joints on both sides of each vertebra through the spine, they move the way they're supposed to. When you have an upper neck injury and those muscles become imbalanced, you have certain areas that start to lose motion. And when you lose motion, if you lose motion over a long period of time, the soft tissue in that area becomes tighter, the muscles in those areas start to form adhesions, and when you lose joint motion and you have asymmetry in the load that's carried on the body, in other words, more weight is carried on one joint versus the other, what happens? The joint starts to wear, and what does the body do? It lays more bone down around the joint. That's what they call degenerative joint disease, right? All degenerative joint disease is your spine has been out of balance for a long time and there's a joint that's taking too much stress, and your body's best way of dealing with it is laying bone down in that particular area. And then there's other injuries that happen. I was dropped upside down on my head wrestling, and on my imaging we can see the C2 and 3 joint. There's all sorts of bone buildup on the joint because when I landed it damaged the bone in that area, and the body did the best that it could to deal with it. So if you have spinal arthritis, it's very common. It's an indicator that you've had a prior neck injury many years before its onset. It's an indicator that the structure of the body is out of balance. It's an indicator that there's joints that aren't moving the way they're supposed to. And why is this important? What fires off the nervous system is motion in the joints. If you have asymmetry in muscle tone and you have arthritis in the joint, it's an indicator that it's been there for at least a decade and your nervous system is not working as well as it should. So anybody who has spinal arthritis should get to an upper cervical office ASAP to correct this upper cervical spine misalignment, to allow the structure and the muscle tone to become more symmetric through the body, and to slow down that degenerative process and to increase the nervous system's ability to function the way that it's supposed to. What can you do if you don't have spinal arthritis and you want to avoid it? The best preventative that you can do for spinal arthritis is making sure that your upper cervical spine, which houses the postural muscle tone centers, to make sure that it's functioning the way that it's supposed to. A spine that moves the way that it's supposed to and has symmetry in muscles is much less susceptible to developing arthritis. Now, if you ride horses and do a lot of long-term jarring type motions to the spine. Even if you're perfectly in alignment, you're probably going to develop some arthritis, and if that's your love, you'll probably say that it was worth it. But if you want to maximize your body's potential, you want to maximize the body's, what's the word for it? To make it not susceptible to spinal arthritis, one of the best things you can do is get this upper neck corrected. So in our office, we specialize in finding out which bone is misaligned, how it's impacting the cord, how your joints are built, and the x-ray analysis we use is a blueprint. It tells me how you're built, how you're off, so I know how to deliver a force to get the segment back under the body's control. Once that segment that's locked and producing the irritation is cleared, the patient is checked over time to make sure on each visit, is it where it should be or is it off? If the vertebra is still in motion where it should be, there's no correction that's made. If it's locked again, another correction is made to keep the process moving in the right direction. Goal is stabilization. Every day the vertebra is where it should be, spinal muscle tone becomes balanced, the ligament that's been damaged will heal, tighten, and repair. The soft tissue that's been out of balance will start to balance, and the goal is to get the person as well as is possible. So if you're dealing with spinal arthritis, no matter where it is in the spine or hip, we do offer a free consultation in our office. We have 2 offices, one's in Los Angeles. That phone number is 213-399-7772. And we have another office in the South Bay area in Carson, and that phone number is 310-324-6172. If you're outside the LA area, you've come across this video, this makes sense, you want to find an upper cervical doc in your area, don't hesitate to call our office. We'd be happy to find someone in your location that can help you. Hope this information was informational, shed some light on why people develop spinal arthritis, and more importantly, what you can do to help have it happen to you, or if you have it, to help slow it down and maximize your body's health potential. Thanks for listening.